The respiratory system. The respiratory system is a complex organ system responsible for the exchange of gases between the body and the external environment. Its primary function is to provide oxygen to the body's cells while removing carbon dioxide, a waste product of metabolism. Here's an overview of the anatomy and physiology of the respiratory system. Anatomy of the respiratory system. Nose and nasal cavity. The respiratory system begins with the nose, where air is inhaled. The nasal cavity is lined with mucous membranes and tiny hair-like structures called cilia, which help filter, humidify, and warm incoming air. Pharynx. The pharynx, or throat, serves as a common passage for both the respiratory and digestive systems. Larynx. The larynx, commonly known as the voice box, is located just below the pharynx. It contains the vocal cords, which vibrate to produce sound when air passes over them. Trachea. The trachea, or windpipe, is a tube composed of cartilage rings that extend from the larynx into the chest. It carries air to and from the lungs. Bronchial tree. The trachea divides into two bronchi, one leading to each lung. These bronchi further divide into smaller bronchi and bronchioles, creating a branching structure known as the bronchial tree. Lungs. The human body typically has two lungs, one on the right side and one on the left side. Lungs are highly elastic and sponge-like organs responsible for the exchange of oxygen and carbon dioxide in the bloodstream. Alveoli. At the end of the bronchioles are tiny air sacs called alveoli. These structures have thin walls that allow for efficient gas exchange between inhaled air and the bloodstream. Physiology of the respiratory system. 1. Ventilation. Ventilation refers to the process of breathing, which includes both inhalation and exhalation. During inhalation, the diaphragm contracts and moves downward, while the intercostal muscles expand the chest cavity. This increase in volume lowers the air pressure in the lungs, causing air to rush in. Exhalation involves the relaxation of these muscles, reducing the chest cavity's volume and expelling air. 2. Gas exchange. Gas exchange occurs in the alveoli of the lungs. Oxygen from inhaled air diffuses across the thin alveolar walls and into the surrounding capillaries, binding to hemoglobin and red blood cells for transport to body tissues. Simultaneously, carbon dioxide, a waste product of metabolism, diffuses from the bloodstream into the alveoli to be exhaled. 3. Transport of gases. Oxygen-rich blood is carried from the lungs to body tissues via the circulatory system's arteries. Carbon dioxide, produced by cells, is transported back to the lungs through veins, where it is expelled during exhalation. 4. Regulation of breathing. Breathing is regulated by the brainstem, particularly the medulla oblongata. Sensors in the body monitor oxygen and carbon dioxide levels and send signals to adjust the rate and depth of breathing as needed to maintain proper blood gas levels. 5. Respiratory defense mechanisms. The respiratory system has several defense mechanisms to protect against inhaled pathogens and particles. These include mucus secretion, cilia that move trapped particles out of the respiratory tract, and coughing and sneezing reflexes. 6. Control of acid-base balance. The respiratory system plays a role in regulating the body's acid-base balance by adjusting the amount of carbon dioxide exhaled. This helps maintain the pH of the blood within a narrow range. Respiratory support. 1. Low-flow and high-flow cannulas. Low-flow and high-flow nasal cannulas are two methods of delivering oxygen therapy to patients who require additional oxygen to support their respiratory needs. These methods vary in terms of the flow rate and oxygen concentration they provide. Here's an explanation of low-flow and high-flow nasal cannula. Low-flow nasal cannula. 1. Flow rate. A low-flow nasal cannula delivers oxygen at a relatively low flow rate, typically ranging from 1 to 6 liters per minute, LPM. The exact flow rate is prescribed by a healthcare provider based on the patient's specific needs. 2. Oxygen concentration. The oxygen concentration delivered through a low-flow nasal cannula can vary widely, depending on the patient's breathing patterns and the flow rate. It is not precise and may be affected by the patient's inspiratory flow. 3. Use. Low-flow nasal cannula is often used for patients with mild to moderate oxygen requirements. It is commonly used in settings like home care, outpatient clinics, and general hospital care. 4. Advantages. Low-flow nasal cannula is well tolerated by most patients, is non-invasive, and allows for eating, drinking, and speaking while receiving oxygen therapy. High-flow nasal cannula, HFNC. 1. Flow rate. A high-flow nasal cannula delivers oxygen at a much higher flow rate, typically ranging from 30 to 60 lpm or even higher. The high flow rate is capable of providing a more precise and constant oxygen concentration. 2. Oxygen concentration. HFNC systems can deliver a high fraction of inspired oxygen, VO2, often exceeding 90%. This makes them suitable for patients with severe oxygen needs. 3. Use. High-flow nasal cannula is typically used for patients with moderate to severe respiratory distress, including conditions like acute respiratory failure, pneumonia, or acute exacerbations of chronic obstructive pulmonary disease, COPD. It is frequently used in critical care and emergency settings. 4. Advantages. HFNC provides several advantages, including better humidification and temperature control of the delivered air, improved patient comfort, reduced work of breathing, and precise oxygen concentration delivery. 2. Non-invasive ventilation. Non-invasive ventilation, NIV, is a medical treatment that provides ventilatory support to individuals with respiratory failure without the need for an invasive procedure like intubation and mechanical ventilation. NIV is delivered using devices such as positive pressure masks or interfaces, and it can help improve breathing, oxygenation, and carbon dioxide elimination. Here are the key aspects of non-invasive ventilation. Indications for non-invasive ventilation. NIV is typically used for patients who have acute or chronic respiratory conditions that result in respiratory failure or difficulty breathing. Common indications for NIV include: 1. Acute respiratory failure. NIV can be used in cases of acute exacerbations of conditions like chronic obstructive pulmonary disease, COPD, congestive heart failure, CHF, or pneumonia. 2. Chronic respiratory conditions. Individuals with chronic respiratory conditions that cause daytime or nighttime hypoventilation, such as obesity hypoventilation syndrome or neuromuscular disorders, may benefit from long-term NIV. 3. Postoperative support. After certain surgeries, such as upper abdominal or thoracic procedures, NIV can aid in lung expansion and prevent atelectasis, lung collapse. 4. Respiratory distress syndrome. NIV may be used to support premature infants or neonates with respiratory distress syndrome, RDS, who require respiratory support but do not require intubation. Devices used in non-invasive ventilation. Several devices can deliver non-invasive ventilation, including continuous positive airway pressure, CPAP. CPAP delivers a continuous flow of air or a mixture of air and oxygen through a mask or nasal interface at a constant positive pressure. It is often used to treat obstructive sleep apnea and provide support for conditions like CHF. Bilevel positive airway pressure, BiPAP. BiPAP provides two levels of positive pressure, a higher pressure during inhalation, IPAP, and a lower pressure during exhalation, EPAP. This device is often used to assist with ventilation and is helpful for conditions like COPD exacerbations. Benefits of non-invasive ventilation. NIV offers several advantages, including: 1. Avoiding the need for intubation and mechanical ventilation, which can be invasive and have associated risks. 2. Improving oxygenation and carbon dioxide elimination. 3. Reducing the work of breathing, particularly in conditions with increased respiratory effort. 4. Enhancing patient comfort and tolerance compared to invasive ventilation. 5. Allowing for communication, eating, and drinking while receiving ventilation support. Monitoring and management. Patients receiving NIV require close monitoring by healthcare professionals to assess their response to therapy. This includes monitoring vital signs, oxygen saturation, and respiratory parameters. Adjustments to pressure settings and interface type may be necessary to optimize treatment. Invasive ventilation. Invasive ventilation, also known as mechanical ventilation or intubation, is a medical procedure that provides life support by mechanically assisting or taking over a patient's breathing when they are unable to do so adequately on their own. This procedure is used in various clinical settings, including intensive care units, ICUs, operating rooms, and emergency departments. Here are the key aspects of invasive ventilation. Indications for invasive ventilation. Invasive ventilation is typically indicated for patients who have severe respiratory failure or conditions that significantly compromise their ability to breathe effectively. Common indications include acute respiratory failure, patients with acute respiratory distress syndrome, ARDS, severe pneumonia, or other acute respiratory conditions may require intubation and mechanical ventilation when they are unable to maintain sufficient oxygen levels or eliminate excess carbon dioxide. Surgery. General anesthesia often requires endotracheal intubation and mechanical ventilation to maintain airway patency and provide controlled breathing during surgical procedures. Neuromuscular weakness. Patients with conditions that cause neuromuscular weakness, such as Guillain-Barré syndrome or myasthenia gravis, may require mechanical ventilation when their respiratory muscles are severely impaired. Coma or altered mental status. Patients with altered mental status, including those in a coma due to various causes, may need mechanical ventilation to ensure adequate oxygenation and ventilation. Inability to protect airway. Patients who cannot protect their airway due to impaired consciousness or other factors are at risk of aspiration and may require endotracheal intubation. Mechanical ventilator. A mechanical ventilator is a specialized medical device that assists with breathing. It delivers controlled volumes of air or oxygen to the patient's lungs and provides positive pressure to facilitate inhalation. Ventilators can be set to various modes to match the patient's specific respiratory needs. Endotracheal intubation. This procedure involves inserting an endotracheal tube into the patient's airway through the mouth or nose. The tube is advanced into the trachea, windpipe, to maintain an open airway and provide a direct conduit for mechanical ventilation. Monitoring and management. Patients receiving invasive ventilation require continuous monitoring of several parameters, including oxygen levels, carbon dioxide levels, ventilator settings, and vital signs. Ventilator settings, such as tidal volume and respiratory rate, are adjusted by healthcare providers to optimize respiratory support. Ventilator alarms. Ventilator alarms are essential safety features on mechanical ventilators that monitor various aspects of a patient's respiratory and ventilatory status. These alarms are designed to alert healthcare providers to any deviations from the prescribed ventilator settings or changes in the patient's condition. Ventilator alarms are crucial for patient safety and ensuring that the patient receives appropriate ventilation. Common types of ventilator alarms include 1. High airway pressure alarm. This alarm is triggered when the pressure in the patient's airway exceeds a preset high pressure limit. High airway pressure may indicate airway obstruction, increased resistance in the respiratory system, or patient ventilator asynchrony. This alarm helps prevent barotrauma and pneumothorax. 2. Low exhaled tidal volume alarm. This alarm activates when the exhaled tidal volume falls below a set threshold. It may indicate disconnection or leakage in the ventilator circuit, endotracheal tube cuff failure, or other issues that can compromise ventilation. 3. High exhaled tidal volume alarm. The high exhaled tidal volume alarm alerts when the patient's exhaled tidal volume exceeds a predetermined upper limit. This may signal lung overdistension or the need to adjust ventilator settings to avoid volute trauma. 4. Low minute ventilation alarm. Minute ventilation is the product of respiratory rate and tidal volume. This alarm activates when the minute ventilation falls below a preset minimum threshold, potentially indicating hypoventilation or inadequate ventilation. 5. High respiratory rate alarm. This alarm is triggered when the patient's respiratory rate exceeds a defined upper limit. It may be a sign of increased patient effort, anxiety, or respiratory distress. 6. Apnea alarm. An apnea alarm is set to detect a lack of spontaneous breathing. If the ventilator does not detect any respiratory effort, for example, no chest rise or fall, it will trigger the alarm. This alarm is important for patients who require support for their respiratory effort. 7. High VO2 alarm. The high fraction of inspired oxygen, VO2, alarm is activated when the delivered oxygen concentration exceeds a set upper limit. This alarm can prevent hyperoxygenation, which may be harmful to the patient. 8. Low VO2 alarm. Conversely, The low FiO2 alarm is triggered when the delivered oxygen concentration falls below a preset lower limit, indicating that the patient is not receiving the prescribed oxygen. 9. Low battery alarm. This alarm warns healthcare providers when the ventilator's battery power is low and needs recharging or replacement. 10. Disconnection or leak alarm. This alarm is activated when there is a disconnection or significant air leak in the ventilator circuit, which could affect ventilation. 11. Ventilator malfunction or disconnect alarm. This alarm is triggered when the ventilator detects a technical malfunction or a disconnection from the patient. 12. Low oxygen supply alarm. If the oxygen supply to the ventilator falls below a safe level, this alarm alerts healthcare providers.